Thank you.
Wonderful. Thanks, Dr. Tully.
Hello, can you hear me now?
Yes, we can hear you now. Thank you very much.
Thank you for the informative, great presentations and for having me today in the conference. I'm not sure why my camera is not working. I apologize. I think it's a technical issue. This is Dr. Mariam El Houchaimi. I'm a senior patient educator. I work in Cleveland Clinic, Abu Dhabi in United Arab Emirates. My presentation today will be about self-compassion and emotional intelligence in nurses. In the beginning, I would like to disclose that I have no actual or potential conflict of interest in relation to this presentation. So the background of my study was that in the hospital settings, the nurses usually provide care while they are under emotional tense when the patients are suffering and they have pain. So nurses might feel emotionally exhausted and they might lose their sense of personal security and sufficiency. So developing self-compassion and emotional intelligence is very important because it will help develop more effective relationships with the patients and their families and even the communities. It will help them cope with problems that they might encounter with individuals and maintain a healthy life with their friends, families, and spouses. So the significance of the study was that nurses who are emotionally intelligent can manage emotions well and better in their relationships with their patients, families, other healthcare professionals, and even in their personal, on their personal level. Similarly, nurses who have the ability for self-compassion can show compassion more better for the patients who are they are caring for. So this study will identify the relationship between self-compassion and emotional intelligence in nurses working in the Middle East. And the results of the study will help us maybe invent programs to improve self-compassion and emotional intelligence in nurses and provide the direction for future studies on the same topic. So the purpose was to examine the relationship between self-compassion and emotional intelligence among staff nurses who are working on acute care units at a tertiary hospital in United Arab Emirates. The research question was, what is the relationship between self-compassion and emotional intelligence in staff nurses working on acute care units? So the methodology was, the design was a descriptive correlational cross-sectional study. The setting was the tertiary hospital and it was conducted, as we said before, on acute care units. The sample was a total of 300 staff nurses working on those units. Nurse managers, assistant nurse managers, and practical nurses were excluded. And the eligibility criteria was that those staff nurses need to be working on the acute care units for at least 6 months and above. The expected response rate was at least 100 participants, which is 33% of all the nurses working on the identified units. The acute care unit specialties were different. We had cardiac, we had neurology, and we had medical and surgical units. So the instrument used to conduct the study were they were 3 instruments. One of them was developed by myself, by the investigator. So it was a 7-item demographic background questionnaire to ask about the age, gender, years of experience in the acute care unit and in the current hospital, the highest level of education, and the continent of origin. Because the hospital is like highly diverse, so it was very important to know as well the continent of origin, and it might be also related to compassion and emotional intelligence. The other tool was the self-compassion scale, which is the short form. This was developed by Race, Palmer, and Neff, and the questionnaire components of self-compassion. So it's self-kindness versus self-judgment, humanity versus isolation, and mindfulness versus over-identification. It was a 12-item version. So the original version is 26 items. The short form is a 12 items developed from the 26 items version. So the responses are given on a 5-point scale ranging from 1, which is almost never, to 5, which is always. Excuse me. And then the overall score has demonstrated adequate internal consistency with Cronbach alpha around 0.85. The internal consistency, you can see the internal consistency of the subscales from self-kindness, self-judgment, common humanity, isolation, mindfulness, and over-identification. The third tool was the Emotional Intelligence Questionnaire short form. It was developed by Bidrites and Fernaham. It is a 30 items questionnaire to assess the ability to identify and manage one's own emotions and the emotions of others. So it includes 2 items from a 15 facet of emotional intelligence questionnaire. So we have also 2 forms, the long trait emotional intelligence questionnaire and this one, the short form. And I used in my study the short form of the questionnaire. And it is also given on a 7-point Likert scale from 1, completely disagree, to 7, which is completely agree. It has also a good internal consistency, which is 0.88. And you can see the Cronbach alpha of all the global trait and the 4 factors of emotional intelligence. Global trait, well-being, self-control, emotionality, and sociability. So I would like to mention that in the literature review, there was only 2 studies that mentioned the relationship between self-compassion and emotional intelligence in nurses. One of them was conducted for undergraduate nurses who are still studying the nursing, and the other one was done in USA by Heffren et al., which the study explored the relationship between both self-compassion and emotional intelligence in nurses. So the results, as I mentioned, the survey was sent to around 300 participants. 84 participants were responded to the survey, which makes the response rate of 34%. The participants were mostly females, 86.9%, and then the majority age between 27 to 37 years old. The years of experience in the current hospital and in acute care units were mostly around 3 years. The highest level of degree was bachelor degree in nursing. And for the continent of origin, the majority of nurses came from Asia and then followed by Europe. So the results, first, the reliability of the research instruments. So the Cronbach alpha for the total self-compassion short form questionnaire was 0.80. The Cronbach alpha for the total scale was good, suggesting a good internal consistency of the scale. And then the Cronbach alpha for the trait emotional intelligence questionnaire short form was 0.92. Also, it's shown also excellent for the study. It shows the total scale for the study was excellent, suggesting an excellent internal consistency of the scale. So the analysis of the research questions. So the mean self-compassion score was 3.42, and for the trait emotional intelligence was 5.1. We computed the Pearson correlation for the self-compassion score and the emotional intelligence score, and there was a positive correlation between both aspects. So it was 0.71. And there was also a positive correlation between emotional intelligence and the 6 subscales of self-compassion scale as well. So, and the study, and this was also in the study that was done in the United States, it showed the same results. The results indicated also a positive correlation between both self-compassion and emotional intelligence in nurses. We did an additional analysis also to examine the relationship between age and self-compassion and emotional intelligence, and there was a positive correlation between age and both aspects. We did also additional analysis to examine the relationship between months, years of experience, and both self-compassion and emotional intelligence. There was a correlation, but it was negative. So the correlation existed really, but no statistical significance was found between like years or months of experience and the self-compassion emotional intelligence. Also one more analysis was done to examine the relationship between months, years of experience in the hospital in the current acute care unit. Also, it indicated a correlation, but there was no statistical significance. No was found to for the correlation between working in acute care unit and self-compassion and emotional intelligence. The results revealed a significant, as we said, positive association between self-compassion and emotional intelligence. So the self-compassion score indicated that it is a moderate level of self-compassion. So the moderate is between 2.5 to 3.5, and the study showed 3.42. And the total mean score for the trait emotional intelligence was 5, and then it also indicates a high level on trait emotional intelligence. The mean score is between 5 and 6, indicates high level, and the study showed a high level of emotional intelligence in nurses working on acute care units in the current hospital. So the implication of this study for education, for sure, developing self-compassion in nursing students can be helpful in preparing them to be more mindful, sensitive, and loving to themselves, because when you have a compassion for yourself, you will be able to give better compassion for others. So nurse educators can develop interventions that enhance self-compassion in nursing students, so such as mindfulness-based intervention, that have been shown to be an effective way not only to develop self-compassion, but also compassion for others. So during their studies, their nursing studies, the interaction between nurses and their patient is expected to go beyond only communication of information. So we need to look into the patients as a holistic, we need to look to the patient as a holistic individual and deliver our care holistically. So we don't only communicate to give information. We need only to be aware of the patient emotional needs and psychological needs as well. So nurses need to be emotionally intelligent to know how to connect the emotions of the patients as well as those of other healthcare personnel in the hospital. So developing emotional intelligence in nursing students can be also helpful to prepare them to know how to connect those emotions, especially students when they in the nursing school, when we are taught the nursing care, it is very different when we go to the hospital as a setting. So usually we have a reality shock, because what we studied in theory, it will not be the same when we are really working with patients and taking care of them as a patient. So implications for practice, nurses being crucial members of the healthcare, so they have a major responsibility to provide quality care services, and to be able to provide this high quality care, they need to be emotionally intelligent, self-compassionate, and have good communication skills. So in this study, the nurses had a moderate level of self-compassion and high level of emotional intelligence. So it's very important to sustain this high level of emotional intelligence and help support them to increase the level of self-compassion. So we can identify and support RNs that have low or moderate levels of self-compassion, and this will be important, and it will positively affect the nursing care provided to the patient and their families. So identifying nurses can be through screening, and it would be an important step for hospitals to offer interventions and training to enhance the self-compassion for those nurses. And as a recommendations from the study for future research is that, so some of the limitations that the study was done only in one hospital, and so you cannot generalize the results of the study. So a replication would be good in another hospitals. So as this study was the first in the Middle East to examine the relationship between self-compassion and emotional intelligence and emotional intelligence in nurses, it would be important to replicate the study, as we said, in the Middle East, and include not only RNs, so also to include practical nurses and nurse leaders as well, because the nurse leaders, maybe to study their self-compassion and emotional intelligence, it's also crucial, because how I think it will be reflected on how they treat or how they lead and deal with their nurses on the units. So future studies on ways to improve and or develop self-compassion may be vital for preventing compassion fatigue and promoting compassionate care between healthcare professionals, especially nurses. And further studies on the way to integrate emotional intelligence competencies to the recruitment programs of nurses. It would be also of great benefit to help nurses to regulate and control their own emotions and correctly sense, interpret, and handle the emotions of others. So a few nurses, when they start working and when they come to the reality of the job, they will start feeling depressed, and they will cry, they will be like sad on seeing a patient who is like dying, or a patient who is in pain, and the family who are really like they have no other options to support or help their patient who is suffering. So I think help them understand and maybe control their own emotions will make them will provide them with a better ability and help them to maybe not have this reality shock when they start working in the real hospital environment. So studies that compare the relationship between self-compassion, emotional intelligence, and patient satisfaction scores might give an insight about the importance of improving, developing self-compassion and emotional intelligence. So also a study can be done on how, if you have like highly nurses who have like high self-compassion, emotional intelligence, and how their patients are being satisfied with them being compassionate. I think this would be also a future study that might give us an insight about the importance of self-compassion and emotional intelligence for nurses. And apology. And finally, studies also that can compare between the relationship of between self-compassion, emotional intelligence, and nurses' satisfaction as well can give us an insight about the importance of improving or developing self-compassion and emotional intelligence in nurses to have higher nurses' satisfaction and better retention of nurses. As well, nurses' satisfaction is a very important aspect that help retain nurses and keep them like more years in the job or in the hospital. So maybe comparing the relationship of self-compassion, emotional intelligence on their satisfaction would be also a good study to show the importance of those aspects in for the nurses. So thank you.
Well, thank you so much for that presentation.
Thank you.